Welcome to this comprehensive exam preparation guide on medication side effects, adverse effects, and allergies for the PTCB 2026 certification. This content falls under the medications domain, which makes up 40% of the exam. Today, we will master key definitions, review high-yield drug classes and their associated risks, discuss critical drug interactions and cross-sensitivities, and complete practice questions to solidify your knowledge. The medications domain accounts for 40% of the scored questions on the PTCB exam. Key areas include generic/brand names, drug interactions, contraindications, and, critically, side effects, adverse effects, and allergies. Side effects are expected and predictable reactions, like drowsiness from diphenhydramine. Adverse effects are unintended, harmful responses that require intervention. Allergic reactions are immune-mediated and range from a mild rash to anaphylaxis. We must also distinguish between type A, which are predictable, and type B, which are unpredictable reactions. For beta blockers, remember the memory tool: 1 heart, 2 lungs. Common side effects include bradycardia, hypotension, and fatigue. Critical contraindications are asthma or COPD due to the risk of bronchospasm and pre-existing bradycardia. ACE inhibitors are identified by the quote "pril" suffix. The major side effect is a persistent dry cough in about 20% of patients. They are strictly contraindicated in pregnancy, as they are teratogenic, causing fetal harm. They should also be avoided with potassium supplements and NSAIDs. Statins carry a risk of muscle toxicity, which progresses from myalgias to rhabdomyolysis, a rare but fatal breakdown of muscle tissue leading to kidney damage. High doses, especially simvastatin 80 milligrams, and drug interactions with fibrates increase this risk. Tetracyclines cause permanent tooth discoloration in children under 8 and photosensitivity. Fluoroquinolones carry a black box warning for tendon rupture, particularly the Achilles tendon, and should be avoided in patients with myasthenia gravis or tendon disorders. The opioid overdose triad consists of pinpoint pupils, respiratory depression, and decreased consciousness. Common side effects include constipation, nausea, and sedation. First-generation antihistamines are highly sedating due to anticholinergic effects, while second-generation antihistamines are non-drowsy or less sedating. A large percentage of patients report a penicillin allergy, though few are truly allergic. Cross-sensitivity exists between penicillin and cephalosporins, or carbapenems. Always document the specific reaction, like rash or anaphylaxis, and never abbreviate the drug name. Critical contraindications include aspirin plus children with viral infection, risking Reyes syndrome. Nitrates combined with PDE5 inhibitors can cause severe hypotension. Key black box warnings to memorize are fluoroquinolones for tendon rupture and opioids for addiction risk. Use drug suffixes and mnemonics like "new mothers hate labor" to recall high-yield information. Be mindful of common exam traps like similar-sounding drugs and distractors that use opposite conditions. Read patient history completely and eliminate obvious wrong answers first. Test your knowledge. An ACE inhibitor's most associated side effect is a persistent dry cough. Fatigue, cold extremities, and impotence are most likely to occur with beta blockers. The antibacterial drug class associated with tooth discoloration and photosensitivity is tetracyclines. Pupillary dilation is not a typical opioid side effect. They cause constriction, which is part of the overdose triad. A 6-year-old child prescribed aspirin with chickenpox is at risk for Reyes syndrome. A patient taking warfarin should avoid ibuprofen due to the significantly increased risk of bleeding. To prevent medication errors, use tall man lettering for look-alike/sound-alike drugs and separate inventory storage. High-alert medications like insulin and anticoagulants require extra vigilance. Always verify the prescription checklist and recognize drug utilization review flags. Adopt an effective study approach by using active learning and daily practice, focusing on your weak areas. Remember the exam content distribution, with medications being 40%. In your final week, review critical contraindications and practice high-yield calculations. You are now ready to excel. You have mastered key concepts and learned safety strategies. Remember, patient safety is always the priority. Trust your knowledge and good luck on your PTCB exam.